Today, we are joined by Dr. Alison Kole. Dr. Kole is the founding medical director of the Oak Health Sleep Program. She's board certified in sleep, pulmonary, and critical care medicine. She is also a chronic insomniac turned sleep biohacker who's on a mission to empower people to improve their sleep naturally through her podcast called Sleep is My Waking Passion. If you are a physician or a therapist who wants to uplevel your clinical sleep medicine knowledge, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. Every video is eligible for CME credits, so watch all the way to the end and then grab your free CME credit, which is in the video description underneath this video. And if you are a physician who wants to learn more, I'd like to invite you to get my free sleep mini course for outpatient doctors. It's filled with practical tips to use in your clinical practice today. The link to that is also in the video description, or you can get it at intrabalance.com/doctors. All right, Dr. Kole, I am so excited for this conversation today. You are just such a wealth of knowledge when it comes to all things sleep, and I know we're both really passionate about sleep. So one thing I'm curious to hear from other sleep physicians is, what drew you to this field? Why did you become a sleep doctor?
Well, I'll tell you, it kind of started out less altruistic. What I mean is, I worked with someone who did a lot of sleep medicine, and I was doing all the pulmonary critical care for this individual. And honestly, I was like, wait a minute, what's this whole sleep thing about? I think I could do that too. Now, truth be told, so there's a little bit of me being a little competitive, right? But in reality, it was something I was always interested in. But in my particular fellowship, we did a ton of sleep. We had regular clinics in pulmonary fellowship. So I really had a deep exposure to sleep. But I kind of felt when I finished pulmonary critical care fellowship, like I was like, am I really like home crit attending material? I started to have that sort of imposter syndrome. Like, I need to prove to myself that I'm actually capable of being an attending. I need to take the training wheels off. I had been offered a position, and what ended up happening was my father got ill. And then I also would just needed to get over that imposter syndrome. So I decided to come back to New Jersey for my training in California and kind of worked for a couple of years. And then it sort of was in my face. I was seeing sleep patients and I was like, wait a minute, I have this skill set and I really think I could do a good job. And so it was one of those happenstances where I made a phone call to an old program director of mine. And I said, that whole, offer that you made for me to learn about sleep, I really think I should do that. I'm not sure how I should approach it. And he said, well, can you be here in June? And I was like, yes. And he's like, okay, be here in June and you're doing a sleep fellowship. And I was like, this is awesome. And then so that sounds, oh, you didn't really care about sleep. You just sort of decided you wanted to try it. But what ended up happening was it was actually the sleep fellowship itself, that year of just focusing on sleep, that really blew my mind. I all of a sudden became this person who was like, I didn't realize that I slept like crap all the time and that I was constantly being on call was not healthy for me. I didn't realize that people could be in medicine and maybe not be page 24/7. Like, it opened up this Pandora's box of freedom for me that I had literally never seen in my entire life. So that is really where a deep passion was born. Just I saw how it impacted my own life. Yes, I learned about all sorts of cool sleep disorders and I really got into the science of it. But ultimately, in the end, I was like, whoa, there's really something to sleep. I mean, not just for me being able to teach patients about it, but intrinsically, I am changing as a person as a result of actually sleeping. Long-winded answer, but that is the truth.
It's so interesting to hear that because I think a lot of us who go into sleep have some kind of personal experience with either not sleeping well or being tired all the time. And I think, well, as physicians, anyways, we all experience shift work, which we're going to talk about today. We all experience fatigue and excessive daytime sleepiness and stuff like that. And for me, it was also kind of accidental. I had a senior resident who was going into sleep fellowship, and I was like, what is that? Like, that's even a thing? I didn't even know you could do that. This was we probably did our fellowships around the same time, or maybe I did mine a little bit before. And sleep wasn't really a fellowship that people were really thinking about back then.
Amen. It wasn't.
Yeah. So here we are now. Everyone's talking about sleep. It seems like you go on social media and like every other post is about sleep. And there's all these influencers who have their sleep protocols and things like that. And I know a lot of people are struggling with insomnia. The pandemic really highlighted a lot of that. And you personally have had struggles with insomnia. So I'd love to hear more about that and what your experiences were with it and how you overcame issues with insomnia.
So, it started off, I came back and I worked doing my usual pulmonary, critical care, but now I had this added sleep fellowship training. And so I saw a mixture of patients, but I was still taking a mixture of critical care and pulmonary call. And I was eventually recruited to start a sleep program at a large multi specialty practice. And I was so excited about starting this program and like really feeling like I could make a real dent in people appreciating just how important sleep was, that I really kind of fell a bit into my old ways. So, you know, during the regular work week when I wasn't on call, I did okay. For the most part, I could let things go. I could engage, I could basically relax and fall asleep. And generally speaking, I was mostly able to maintain sleep. And then I would have my call week. So we did 7 days in a row. And during that week, there were a lot of overnight pages, a lot of, as we know, electronic medical records are electronic, and that means they're on a computer, which means we're getting blue light in our eyeballs. And I would get paged by residents. We'd be going over a case. That was the stipulation, which was a little different than in my day when the idea was that you manage the patient through the night and then talk to the attending in the morning. So a little bit different system. And I wanted to make sure patients were stable. These people were important. And I wanted to make sure I was doing a good job taking care of them, even if it was overnight. So I inevitably was looking at labs in the middle of the night and not being able to get to sleep for a couple of hours. So I went through like a week of sleep deprivation, essentially. Right. But then I'd go back to outpatient, the outpatient world. And I would do that again until my next call. And in my mind, I was like, well, I really don't like the sleep deprivation part of it, but it's just part of the job. So it is what it is. And, okay, fine. And then we had this like thing they call COVID, as we know. And my world sort of imploded from there because what I had realized in hindsight was that when I had trained during residency and fellowship, I really struggled with sleep, but I was in my 20s. I was like, meh, whatever. I'll sleep when I'm dead. I had these like really mythical, outdated notions of how important sleep was. Right. And so I just would like moonlight. I would take extra shifts, that sort of thing. And then what ended up happening was I was like, uh-oh, now I'm in COVID. I'm actually doing the shifts that I did when I was in my 20s that were like 12 hours and overnight and all sorts of things. And I was like, I cannot sleep. Like, I feel like I want to tear my hair out because now it wasn't like that week and then I could go back to my schedule. Now it was, even if I wasn't getting paged after hours after that shift, I was doing night shifts. And I had been someone who, in kind of getting my sleep in order and learning all about cognitive behavioral therapy, which I'm sure you've talked a ton about on your show, essentially what's happening is all that cognitive behavioral therapy rules. You do all the relaxation techniques, you have your time that you're starting to feel sleepy, you have a regular wake up time, you have a regular workout routine, you're eating healthy, all the things I did, all the like pillars of health, if you will, that I was implementing. Then all of a sudden, I couldn't find a way to reconcile the flip flop. I just realized I'm like, I am not flexible. And my idea of flexibility was that I was 25 when I was training. And so it didn't really matter. I could recuperate from that. But now I was going into a pandemic with two toddlers at home. And if anybody knows anything, unless you have freaking soundproof walls and they're home and there's no such thing as daycare, yeah, it doesn't matter if you've got eye masks and all this stuff. I mean, they're screaming. You're going to hear them. It was like I felt literally paralyzed by the impossibility of being able to sleep. So that's really kind of where the wheels fell off the bus, if you will, and things kind of went sideways. So really, honestly, how I managed it is I looked within myself. I tried everything. I did wearing an eye mask. I really don't like white noise so much. That's actually going to do the opposite of relax me. and I just really need a quiet, dark environment. So I tried to do the best I could with earbuds and stuff. And I don't know what it is. It's just that I had a routine. I woke up early. And my body was rejecting any other form that I normally recommend to people who do shift work. And it wasn't stable. It wasn't like, okay, you're going to be on nights for a while and your body's going to adjust and then you go to days. It was like day, night, off. And I was like, I can't keep the schedule. There was no discussion about trying to create a schedule that would be a little bit more, I don't know, humane, if you will. It just was what it was. We had who we had, and we were picked and chosen to go in, and I was going to do my duty. But yeah, I mean, for me, correcting my insomnia started with making a mental decision to do something that I don't normally recommend, which is to have that bridge between work and me, take a match and light it on fire. I was like, I'm out. I'm not doing this anymore. I don't recommend that, guys. I don't. I'm going to be honest with you. But for me, it felt like I got to the point, in part because of who I was, because I was stubborn and thought I could do it all. And I was superwoman, right? I had to adjust my mentality. I just got to the point where I had no gas left in the tank. I wasn't exercising regularly, and I knew I needed to. I wasn't eating as well. In fact, I was barely eating because I just felt like, I'm like, I don't have an appetite. I have no energy. I just need to get through my day. And that actually occurred even after we were able to transition out of that shift work, when things sort of calmed down. But we went right back to, okay, now you have your regular schedule, and every, fourth week, you're doing your 7 days again. And there was something about what had happened. I could not tolerate the sleep deprivation anymore. Like, even that week was like, I can't go back to what I was doing. I just can't do it anymore. And maybe it was how the negative self-talk that I told myself, but I also think that's where the seeds of, I need to fix my sleep. I can't do this. This isn't healthy. But what am I going to do next? How can I affect change? How can I still derive meaning for my career when I literally want to give up what I've done, what I've trained to do? I felt like insane for thinking that. And inevitably, lighting the match and deciding while sitting in the ICU, finishing my notes, the idea of the podcast was born. So you could say that little nugget grew and grew to the point where, after repeated attempts to discuss a schedule that would allow me to pursue those podcast interests, that would give me a longer break from call. Maybe I could do 6 weeks instead of every 4, like deeply seeking to make it work and feeling like nobody was listening to me. I decided to listen to myself. So again, I can't say that this is the smartest approach, but I can say it's the one I took. And I can also say it's one I do not regret. So if anybody out there is feeling the way I feel, what I can say is, ultimately, I think one of the things that we're taught in medicine is that we're trained to do a certain job, and that's what we do forever. And what I've come to find is that we grow as people. I became a mom during all of this, like, my world suddenly wasn't just all about residency and fellowship. It was like, okay, now I have mommy duty. What does that look like? Toddlers during the pandemic. It looked like I missed a lot of their youth, a lot of those toddler years. And then kind of saying, okay, I can see patients consistently and I can do what I continue to do, but I'm affecting change one person at a time. Can I make a better, more global impact? And somehow, instead of fighting this desire for change, this evolution within myself, I accepted it. And that allowed me to start to regulate all of this like hyperactive amygdala response, this fight or flight response that I was like stuck in. I literally could not get myself out of it. And honestly, it took an antidepressant. It took a sleep aid. Yes, guys, I took medication just to kind of break the cycle. And then I was like, wait a minute, I feel less insane. I feel more in control. It took talking to folks. It took all of that combination of things. And then eventually, gradually over time, I was able to chill and I was able to get to the point where I don't take anything. I'm back to my regular routine. I no longer am that 5 a.m. junkie. I really do sleep in a little bit longer and I get my exercise during the day because, as you can see, I'm talking to you from the comfort of my office at home. And I've been able to embrace different a different career trajectory. So for me, it was I needed to fix my sleep first, but I needed to kind of fix the burnout piece. And the only way I figured out how to do that was to kind of sit, stew, and accept that I was evolving and needed a change.
Amazing. Thank you so much for sharing all of that. And I think you've touched on so many important things that I think a lot of people can relate to. One of them was just listening to your body and just listening to yourself and recognizing, like, wait a minute, this schedule is not working for me. And in fact, it's harmful. It's harming your health, it's harming your, relationships, your ability to spend time with your kids, and there's so many different layers to it. And I think it's really important to acknowledge that because I think, so as you were saying, as physicians, we feel like we're stuck on this linear path. You do your residency, maybe you do a fellowship, then you get a job, and that's it. And that's what you do for the rest of your life. But we have so many options. And like what you're doing is amazing. Like you've got these creative projects now, you've got a podcast, and I'm sure neither of us thought we'd have a podcast or a YouTube channel when we were in medical training.
Oh, heck no. I'm like, what is that? I didn't even know what to do. I was like, let me just Google some videos on YouTube to figure it out. But it just, yeah, it feels so good and so liberating to kind of listen to myself and not judge myself about it either. I think that's one of the things I see a lot with folks that describe insomnia. When I really ask them, you hear a lot of judgment. You hear, I know I should be off the electronics, but I'm not. I know I should go to bed and I'm tired, but I kind of get my second wind and then I'm not. I know I should be exercising, but I just feel too tired. But it's said in a way that's very negative toward themselves, like they are judging themselves. And I cannot emphasize enough, believe me, as somebody who still works on not judging myself, to slowly start to deprogram this negativity toward myself has been really instrumental in kind of setting the bar higher and higher in terms of moving positively in the right direction. Because I stopped being like, oh, you're a bad person because you're not tired. I was like, why is it that you feel not tired? Why is it that you have a busy brain? I started to, rather than judging, I started to question. You touched on something that was so key, which is sleep for me was a symptom. My sleep disruption was truly a vital sign that if anybody asked me, they would see that clearly there was a bigger issue going on in the background that needed to be addressed. Sometimes it just takes a little bit of that self reflection and, dare I say, self love, if I want to sound super corny, to really make yourself a priority. And then suddenly all the other pieces seem to fall in place. It does take time, but if you're patient, they fall into place.
Thank you for sharing that because I think, just a little bit of self-compassion can go a long way. Just even in reducing that hyperarousal response that you were talking about, that fight, flight, and freeze response. Yeah, and as you were saying, sometimes medications can be helpful. We talk a lot on this channel about helping people without medication, but they are a tool, right? So medications are a useful tool to be used appropriately, short term, to give people support. But then zooming out and getting curious about what is really happening and having conversations around that is so powerful.
It's almost like you got to break the cycle a bit. And that's how I see medications. Like sometimes if you can break the cycle and just get a little bit of rest, even if it's a medicated rest, and you look to say, I don't want to do this forever. I knew I certainly didn't want to be on medications forever, but I knew I'm like, I am freaking desperate. I don't know what else to do. So I do think, as you mentioned, there can be a role, and then that helps to get you in a place where you can be accepting of all those things we know you need to do. Have a regular wake up time and have your nighttime ritual. Stop with the revenge sleep procrastination stuff and staying up because you need your alone time. Like start to really, as you mentioned, become more introspective. Yeah, it's been monumental for me.
Okay, so for those doctors who are doing shift work, or maybe you're seeing clients or patients who are shift workers. I know I don't do shift work anymore. I mean, I was in the same boat as you. I'm like, this is not good for my body. I can't handle this. I don't want to work like that. So now I've set up my practice in such a way that I work regular hours that work for me. But many people are not able to do that. And so for physicians who are doing shift work, or if you're working with patients who are shift workers, Can you just share some insights on maybe how to think about that, how to support people, how to navigate the issues? What are the issues with shift work? I think sometimes it's not even recognized. What are the long-term consequences? So yeah, if you could share some thoughts on that.
Oh, sure. I've got many. And as I mentioned to you and shared with you, I was really terrible, even though I was trying to do a lot of the shift work recommendations I'm about to tell you. But hopefully, you're going to be a lot better about them than me. So please, no judgment on me. I'm just going to share with you information that we, kind of know about shift work. Really, I look at shift work in two ways. We have a natural circadian rhythm. That's number one, right? So, Nishi, you may be a morning person, and let's say I'm an evening person, right? If I'm an evening person, having to get up early in the morning when I'm most active at night, that's shift work. Conversely, if you're an early bird and you want to be bright and bushy-tailed in the morning, but you've got to now go into work and be up all night, for you, that shift work may be even more detrimental aside from just, the natural sort of rhythm that we have. So we probably have some sort of natural proclivity towards certain hours where we're most productive just because that's how our brains operate. So kind of being aware of that, I think, is important because some people think, okay, shift work's only night shift work. And that's actually not true, right? But really what it comes down to is if that is your chosen shift and you are accepting of that, we can start to modify our behaviors to make it better for us to make that more manageable. So some of the tricks, for example, is if you need to be awake and you're feeling not awake, instead of like having a giant bolus of caffeine at that beginning of the shift, some of the recommendations are to have smaller slips. So maybe 50. So a cup of coffee is roughly 200 milligrams of caffeine, as an example. So maybe doing 50 milligrams, like taking smaller sips and having like a little mini bolus of caffeine every couple of hours. And then as you get toward the tail end of that shift, let's say about 3 or 4 hours before you're about to get off of the shift, assuming that is manageable for you, then kind of backing off the caffeine. Sometimes if you have a shift in the middle of the night, being able to escape and take a nap, and maybe if you're really tired, having that baby bolus of caffeine and then taking a nap, a so-called coffee nap, that might help you feel a little bit more rejuvenated to also help you get through to the end of the shift. The other thing is the exposure to light. So when you come off a night shift, for example, the sun may be rising depending on what time you're leaving, right? So getting those, I'm sure they make way cooler glasses than they do back in the day, but my understanding of those like complete blackout shades are like the kind like when you have, you see the older adults who have eye surgery and then they're like always wearing these crazy blackout shades. So those are like less styling, but maybe if you can find the equivalent just to see if you really can block out as much sunlight as possible and just basically try to make it home. And then at home, know that what would you do normally when you get home from work if you were working a regular shift, for example? Like, I don't get off of my day and then be like, okay, I'm ready for bed. I don't think that's realistic. So, still having that routine that you normally would at any desired bedtime and winding down and being accepting that you're not going to immediately go to sleep is probably not a terrible idea, right? And then for some people, they may still find they'll sleep for a little bit and then they're awake. So, one of the things that you could do is even though it's probably ideal to get that full quote unquote 7 to 9 hours all in one clump, maybe for you, it's a couple of chunks. Maybe you nap for a bit and then you're up for a bit so that you can spend time with family or whatever else is going on. You could attend to your affairs and then you take a nap before you go in to work so that you are maximizing the amount of sleep, even if it's not continuous sleep. Those are just a couple of examples. We can go on and on. Sometimes it's appropriate, again, to use sleep aids. But again, I'm going to emphasize if we can get away without, it's not like the sleep aids were magical for me. Like, oh, now I'm sleeping. It still kind of sucked all around. And I still didn't feel like I was sleeping great. I just felt like, oh, now I've drugged myself and I'm still kind of awake. My sleep is still crappy. So I can't say it was a panacea. But I think those are some of the things that are guardrails that you could try to do to sort of improve the quality of your sleep on that in that shift work role.
That's really helpful. Yeah, great tips. And I'll also add that one thing I've done for some of my patients, like, so I have patients who maybe work in healthcare or other professions where they're doing shifts, and especially those irregular shifts that you were talking about, where
Hmm.
it's like day, night, and then like again, versus like a whole week of nights or whatnot. I've even sometimes written letters for their employer asking them to modify schedules and have had some success with that. And then with some patients, like the ones who are really suffering, like we have the, all right, let's get real conversation. Like, is this a viable long-term schedule for you? Or do we
That's a
need to
very
think
good
about,
point.
yeah. And so, I have a particular person in mind who works in healthcare, and they ended up going back to day shifts because they just realized the impact it was having on them.
Sometimes even if you get paid a little bit more, and I think I've heard that a lot from some of
Yeah.
my patients, they're like, yeah, I only sleep 5 hours, but I make all this extra money, so it's great. I'm like, and you're not going to be alive if you continue on this trajectory. Like, you got to think of the bigger picture. And it's really hard to do sometimes because they do tempt you, like, we know this is bad for you, but here's the sprinkling a little bit of extra cash. I just came to find that it wasn't worth killing myself over, quite literally. I was like, all right, I certainly don't make what I made before, and it's better. I mean, it's better. So it's okay. And, there's always other opportunities. The one thing, physicians out there, healthcare providers out there, the one thing that your training allows you to do is it opens up windows of opportunity you never thought possible. Nishi knows I actually am a medical strategist for a continuing medical education company. I never thought in a million years that's what I would be doing. And it's really exciting to try to affect positive medical education, particularly in sleep and pulmonary diseases. Really thinking of cool curricula that I think would really resonate with folks such as yourself. That's actually really fulfilling. And I never did I think, in the ICU, I'm going to like, yeah, eventually I'm going to be writing for a CME company. No, not at all. You never know. So it opens up doors. Keep your options open if that's the right thing for you.
That's so important. I'm so glad you mentioned that because, yeah, I think again, as physicians, we often get boxed in, or there can be a lot of resistance to, exploring these other creative opportunities, or you don't even know that they exist or where to even look for them. So I'm curious to hear, I'm sure our listeners would be curious to hear what your schedule looks like now. Like are you still working in the ICU, or like what's a typical work day? What are all the things that you're doing?
So, literally by day, I do continuing medical education. So, that is essentially sort of a 9 to 5 ish job, if you will. It's kind of more 8 to 4, but we have meetings during certain times. So, we don't have meetings continuously 24/7. We're really sort of meeting, but we're also brainstorming. We're looking for opportunities, working on grants to submit so that we can get funding to pull these programs off so that we could educate folks. So, that's what I do by day. And I carve out before I start work some time to see some patients in the morning. So I basically do a bit of sleep moonlighting, if you will. I see patients over the time that I've designated for my lunch break. And then in the evenings, at the tail end of the day, what I do is I reserve some time so that for my small, but my teeny but mighty small sleep telemedicine private practice with Oak Health Center, that I'm available to see patients there. So I really do a mixture of, I would say, about 80% non-clinical and about 20% clinical. That ratio may change. To be truthful, I probably would like more of a 50-50 split, but I don't want to go back to full-time clinical practice in the sense of where I was before. I think I'm sort of enjoying the ride that I'm on now. I have officially decided that if there was an opportunity to do some outpatient pulmonary, I'd be glad to go back and see pulmonary patients, but I'm hanging up the hat. I'm not going to be doing any more ICU. I decided that it really wasn't in me anymore. I felt like I had done my duty. I almost felt like the person who decides that they're going to retire from the army or something. I'm like, and by no means vets do anybody who out there is a vet. I believe me, I'm not trying to compare myself to a vet. All right. But I'm using that as an analogy just to say I feel like I've served the United States in that capacity. I did what I could for everyone. If there was another pandemic, which statistics would argue probably not in our lifetime, so I'm probably safe, I would make the argument that, yeah, I'm sort of done with that. I'll come back to duty if y'all need me, but otherwise I'm going to let sleeping dogs lie. So that's me in a nutshell. And then I squeeze in podcast time when I have time. And I have a website called Ask the Sleep MD where I have blog posts, which, believe it or not, the CME world, because I'm doing so much writing, has allowed me to be more proficient in blog posting. So it's weird because I'm doing all these things that I like that are personal pursuits and then still being able to keep the lights on, if you will, during the day and pay my bills. So that combination has really suited me well. But I am typically done with my day no later than, you're keeping me, so to speak, but I want to talk to you, right? So normally I'm probably done 5-ish or so. And then I still have time when, if the girls have something or what have you, there's flexibility built into my job that I otherwise didn't have when you have like a set list of patients. So I'm able to tend to things for my kids and stuff that they really need. So that's kind of my schedule right now. I'm definitely not working at night and I'm definitely not getting paged at night. And I cannot tell you what that's done for my sympathetic nervous system. Uh, It's been a godsend.
No, that's amazing to hear. And hopefully, if anyone's listening and feeling kind of stuck or burned out or overwhelmed in their job, hopefully this will provide some inspiration and an example of what's possible, because there's a whole universe of possibilities out there waiting for people. It's just a matter of kind of tuning in and exploring. I'm curious to hear what your wind down routine looks like
Oh, sure.
in the evening. Yeah. And how you're prioritizing sleep with, all these different projects, and you're a mom and, you got lots of stuff going on. So how do you prioritize sleep and what's your wind down routine?
So my wind down routine, and I'm going to cough in just a second. Forgive me, I'm recovering from a cold that seems to be lingering. I don't know if it's because I don't have my like super ICU immune system kicking up, because it's been a minute. But man, this cold is really kicking my patukas. So it always ends around 8 o'clock where the girls, we've brushed their teeth. They usually want a snack kind of before bed. So they're starting to munch on a little snack, and then we're going to start getting their toothbrushes ready. But we often will sit in front of the TV and they pick a show. This is the dominated by kids show. My kids are 6 and 8 right now. So there's usually some form of a cartoon on. So we will cuddle on the couch while we're doing that, unless it's a cartoon that I feel like is really interesting. I've been kind of obsessed with Camp Cretaceous lately. That's a Jurassic World kind of show. If it's the Smurfs, it's kind of like a hot poker in my brain. I really have to like wax on, wax off with that one. Not very interesting. But what I do is I have a little journal. And especially when I know I have a number of things that I'm going to need to do the next day, I just start to prioritize a little bit. Like I start to organize in my brain. Okay, I've become a little obsessed about creating time blocks. So, if anybody doesn't know what a time block is, it's a way to become more efficient by really focusing during that particular time. What I thought I was good at was this quote unquote concept of multitasking. And then I discovered I was just being pulled in 100 different directions. And I was just frazzled by the end of the day because I'd be focused over here. Then I'm back on patient care. Then I'm getting paged. And then I'm back on patient care. And then I'm over here answering this text message from my nurse. And then I'm back here. So I kind of felt like I was being pulled in multiple directions. Now I have an opportunity to say, okay, during this block, I'm seeing patients. During this block, I'm going to focus on CME writing. During this block, I'm going to focus on a blog I need to do or a presentation I need to do. And I just sort of segment my day a little bit. And then I build in little 5-minute breaks where I'm like, okay, I've done that for an hour. And maybe I go to the kitchen and I put some dishes in the dishwasher. Or, obviously I have the luxury of doing that sort of in my own home. But that way, it's sort of my version of brain dumping because of that busy brain. And usually it's busyness that surrounds work. Sometimes it's an inspiration and I get a thought and I'll just write it down. Sometimes it's really, I'm feeling, and maybe this is cyclical, like I don't know if it has anything to do with my cycle, but I start to get very introspective and I go, what do I want my future to look like? What am I trying to manifest, if you will, for like what positive energy am I trying to put forth for future projects and for my ambitions? And that keeps me, in the end, it keeps me in a positive frame of mind. So I kind of do that on the couch. And then, depending, maybe midweek, honestly, on a Wednesday, I typically have a glass of wine. When I was burned out, was like, don't talk to me until I have my glass of wine. Now I'm like, okay. It's kind of, so I might on Wednesday, that's like midweek, happy hump day. I might have a glass of wine. On the other days, I'm like obsessed with sleepy time tea. I am trying a new supplement for when I feel like I'm a little bit of hyper aroused, if you will, and I'm having trouble settling down. It's from MD Bio, which is a new company that had approached me. And they have one that has hemp, and they actually have some clinical trials for that. And then they have one that doesn't have anything, it just has botanicals. So I've been trying the one with botanicals, and it seems to get me to the point where I can relax a little bit. So I'm like, okay, this supplement's not so bad. All right. So people try different things, but it has a number of compounds in it. I think I don't remember all of them off the top of my head, but I'm sure you could look it up. But I try to do something that's a little bit more organic. And then what I do is my husband, without a doubt, come 9 o'clock, kids are now in bed, right? We watched our shows, we've tucked them in. He wants to watch a show with me, and so we have cuddle time. What that really means is that probably within 15 minutes, he's going to be like, and I'm going to be staring at him, and I'm not ready for sleep by that time. So he will often have an HGTV show on. I turn that off. And I often will, I have an app called Mind Valley that I signed up for, and they have a number of meditations. So I'll try to do one of those meditations, just put in earbuds. I kind of try to quiet my mind. And there'll be different kinds that I do. I just sort of pick and choose. And then I might do a little bit more writing. I really have to work hard at this. I really try to avoid the social media. I have on nights definitely stayed up an hour later than I should because I got sucked into some random thing on TikTok. For social media, as you're growing a podcast brand and stuff, they encourage you to be on those because that's part of the algorithm. And it is the worst. I'm like watching some chick put on makeup. I'm like, oh, those pants from Hilera look really cool. Like, I just go down this rabbit hole of stupidity. That's all I can say. Like I fall into that algorithm. So I have to be really, really careful not to do that and really try to avoid the blue light. And then and I don't judge if I'm not tired. There's times when and my mind is not going to let me go to sleep until midnight. And then there's times where literally by 10 o'clock, I'm like, oh, I'm really kind of feeling chill. I think I'm really feeling time for bed. More often than not, I find myself able to fall asleep between 10 and 11. And I typically set my alarm for roughly 6:30. And I get around 7.5 hours of sleep. And that for me feels really freaking good. Like if I get 7.5, that's great. And also start to recognize, guys, if you want to track your sleep, that might be helpful. I typically don't because I don't like to have stuff on me. Like I won't wear my watch or anything. I know, Nishi, you have an Aura ring. They've done a lot of data with that. So if you're looking at trends, and that's again, trends, don't get obsessed with the data. But if you wanted to generally know how you're doing, you could use that. And it might kind of give you an estimation or a guesstimation of how many hours of sleep per night you're getting. What I have found is if I sleep 8, I get 7 the next day. So I try to keep it around 7.5 because inevitably I'm like, oh, I'm just going to steal. Like if I sleep an extra half hour, I'm stealing it from the rest of the day. So for the following day. So I kind of know that about myself. So I sort of accept, that's sort of my optimal amount of sleep. And I call it a day. But that's me in a nutshell. I am certainly not perfect. And what I have found in my 40s is that there's times when I want to go out. Yeah, I want to have a couple glasses of wine or I want to have, a mixed drink or something. I know my sleep's not going to be as good. I know that it's going to be crappier, but I just don't care. I'm willing to I'm willing to go out on a limb, if you will.
No, I love that. I mean, it's just so important for people to recognize that sleep fluctuates from night to night, right? So it's not always going to be the exact same amount of hours or the exact same quality every night. And we have to allow some flexibility in our schedules, in how we approach sleep. Like if you're not tired, don't go to bed. These kind of like things that seem obvious, but really have a big impact. But allowing that flexibility takes the anxiety out of it. Because if we're super rigid, like you were saying, like if you're not tired, don't go to bed. For people who are rigid about that, it can actually start to create insomnia. So I love how you shared kind of the fluidity and then the time blocks. That's such a great tip.
Oh, wait, thank you. I did not come up with it by myself. I wish I was the genius who did, but I learned about it and I was like, I'm going to try that. And I got to tell you, I get far more accomplished, but like in a shorter amount of time because I'm not dragging it out. I'm like, this is your time to do it. So step up to the plate and make it happen. And inevitably, I usually do. It's great.
Yeah, and I think it really reinforces the idea that good sleep starts during the day. the things that we do
The
during the
things that you
day,
do,
right?
right?
Like how we approach the day, it really does set us up for how we sleep at night.
And scheduling your exercise even. Like
Mhm.
I'm very much like, all right, I have this half an hour, and sometimes it's a little bit longer because normally, I don't work out for an hour. Today, what I did was my husband had time to do a walk, so we did an hour walk, but I knew I needed to lift, and that was my schedule. I agreed to it. I had committed to that. I block in 30 minutes. If I really did the whole workout that was assigned to me, it would take well over an hour. And I'm like, no, I'm not doing that. I'm doing 30 minutes. That's what that's what I'm committing to, and that's that. And it's worked out really well. That and a regular wake up time. I didn't mention that. I mean, I will get up the same time, including the weekends. I will say that now that my sleep is so much better, I give it about a 30-minute window where I might sleep in an extra 30 minutes just because my kids tend to not harass me for that 30 minutes. But yeah, I definitely try to keep to the same schedule as much as possible.
That makes such a big difference. And okay, and so for any clinicians who are watching this, whether they're a physician or a therapist, what's a clinical tip that you would recommend for them to implement in their practice with their patients and clients?
As far as what they could use or what they should tell their patients or
Yeah.
how they can
So
manage their day.
yeah, so if they're seeing patients who are struggling with sleep and they're not really sure, how to support them or, let's say they have patients with insomnia, what's a clinical tip you might recommend to a physician who has a patient presenting to them with insomnia?
Oh, sure. Well, I mean, I kind of mentioned it, but one really good one is just making sure they're getting up every day at the same time if they can and get them to buy into that. Teach them that their body has habit. Just like you train little kids to sleep, we're like giant children, right? That's what we are. We're kids that grow up to be adults. Doesn't mean that the tools and tips that we use for kids doesn't work in adults. In fact, it very much works for adults. That and really mind the blue light, guys. This is probably the number one thing that we're all pretty bad at. And I guess lastly would be if you have that patient that really cannot put down the work, maybe you talk to them about time blocking. Maybe you start doing that. And that's why I was asking you what you were asking me, because if it was me, what I would do differently if I had full-time clinical practice is I'd say there are certain times when you can bug me. Like maybe if there is like a critical lab or an emergency, okay. But teaching your staff to really respect you because you have time that you need to focus on certain things. So if it can wait till, let's say, the lunch hour or till you're done with that patient, they really respect that. That was something that was a boundary that I was not very good with enforcing. So I would encourage you to have those boundaries with your staff. Again, there's always going to be emergencies that occur and you want to, be able to heed the call of an emergency as necessary. But if it's not an emergency, let me focus on the task at hand. Don't bug me about something that draws my attention away. It's the same advice you'd give a patient. So try to kind of live, walk the walk, as they say. And it makes it easier for you to counsel your patients because you're doing those things, right?
Well, Dr. Allison, this was amazing. Thank you so much. Can you tell us about your podcast and where people can find out more about you?
Oh, absolutely. All right. It's plug time. So, Nishi was actually so kind and taught me all about micro practices on the podcast. So, she is in season one. Believe me, you could check her out. She was amazing. The name of the podcast is Sleep is My Waking Passion. It is available on Apple, Spotify, really wherever you get your favorite podcast apps. Really proud of this. This is something that literally kept me on the planet. Like it kept me going when I was in the lowest of the low. So I cannot emphasize to you enough if any of you want to talk about your sleep journey, you want to spend some time, you're welcome to be a guest. I'm happy to meet and sit with you and I'll help you out as best I can. If you're interested in blog posts, if that's more your jam, podcast, not so much, I have a website. It's called Ask the Sleep MD for my middle initial S, stands for Sanghi. So Alison Sunghi Kole. It's askthesleepmd.com. And I have blog posts on there, things like melatonin supplements that other folks have recommended to me. I have links to it so that you can order it. It's just basically affiliate links on Amazon. There's some affiliate links for some other products that I've tried that I really believe in. And this helps support the podcast. For example, you can sign up for my newsletter. I'll be telling you what the next podcast episodes are, if there's any new blog posts that you might find interesting, if I'm going to be at a pajama party like I was with Dr. Bhopal recently. So it just gives, and any little juicy tidbits that would help you push your sleep along. I will have you know that one of the things I'm really proud of is I really try to make the blogs as evidence-based as possible. And you will find direct references in those blogs to articles. Just hover over it and it'll take you to the PubMed website so that you could actually look up some of the literature yourself and read it. It's really meant to empower you because the more you know about sleep, the more passionate you're inevitably going to become about it because you're going to see just how important it is to like literally every aspect of your life.
Fantastic. So we're going to put those links in the video description below. So the link to your podcast and also to your website and blog. And yeah, for any clinicians who are watching this, so physicians, therapists, this is a great resource for you as the clinician to learn about sleep, but also for your patients and clients, because we want to be referring our patients to credible information. And there's a lot of misinformation out there on social media, online. And so that's why I think it's really important that physicians like Dr. Alison make their voices heard and that we refer our patients to these credible voices like Dr. Alison. So go ahead, subscribe to her podcast, check out her website. And thank you so much, Dr. Alison, for joining me today.
Oh my gosh, it was so much fun. It's always a pleasure speaking with you, Nishi. I just hope I didn't keep you too long. I think we were planning a much shorter version and then we got into so many details. So my apologies, guys. Please, hopefully you hadn't fallen asleep listening to this and you've learned something.
Nothing to apologize for. I mean, we could go on, and I think we'll probably have to schedule another one and we can go into some other maybe biohacking topics or something next time. But
Ooh, fun.
yeah,
I love it.
But no, I really appreciate your time. Thank you so much.
Of course.
If you are a physician who wants to learn more, I'd like to invite you to get my free sleep mini course for outpatient doctors. It's filled with practical tips to use in your clinical practice today. The link to that is also in the video description, or you can get it at intrabalance.com/doctors.